Hi, everybody. For this week's clinical conference, I saw a patient, AB. She is 12 years old and she has no past medical or psychiatric history, and she was brought in via EMS after ingestion of an unknown amount of Benadryl. Shortly after taking the Benadryl, she started experiencing some hallucinations of seeing spiders and flies in the room and was brought into the ED by EMS. And we went to go see her, and during our assessment, she expresses experiencing several current stressors. Her mother and her father have recently separated and are pursuing a divorce. Her mother moved out of the home August of 2021 and currently lives with a friend. The patient's mother does visit several times per week. However, the patient remains to live with her father at this time. Of note, AB did witness her father's injury 3 years ago after falling into a hole, causing a severe cervical spine injury. And after the injury, her father was not able to work and is in the home more often after his injury. Since her father's injury, she is experiencing some frequent confrontations with him, who's been yelling, screaming, and using profanity towards her. Her mother also verified that the patient's father is abusive with his language toward her and projects his personal frustrations onto the patient. She also has been reporting some issues in school. She is not doing well and is making poor grades, and she's also often worried about other students and what they think about her, and she's very insecure about her personal appearance, and that's been causing her a lot of distress. Um, she has also had in the past experienced 3 panic attacks. They were all related and triggered by the teacher asking her to do something challenging in school, and they manifested as feeling overwhelmed and crying. Also, the patient has been endorsing coping mechanisms of hair pulling. She reports hair pulling out of her head for a long time, and she describes her mood as whatever, and she rates her mood as a 6 out of 10. She reports feeling happy prior to her admission and denies ever having any suicidal ideations or any previous suicide attempts or feeling of wanting to die. She was very persistent that the incident of taking the Benadryl was not a suicide attempt, and that she took all the pills to see what would happen, quote unquote. And after taking the Benadryl and starting to experience the hallucinations, she started to become afraid, and went to the bathroom to try to force herself to throw up, and started drinking water. And then she also told her dad that she took the Benadryl and then came into the ER. So after we talked to the patient, we also talked to the mother, and she feels that the stress from her father's injury, the emotional abuse from her father, as well as starting puberty and the COVID pandemic, has been the most influential precipitating factors leading up to her Benadryl ingestion. Her mother believes that the patient did not try to commit suicide. She does express concerns about AD's father's abusive language and also his drinking habits. Also, she's also concerned about the patient's group of friends who is assisting her in gaining access to nicotine, vapes, marijuana, and prescribed medications such as Lasix and other unknown prescribed medications. So, upon psychiatric review of systems, she does meet the diagnostic DSM-5 criteria for generalized anxiety, as well as trichotillomania and some mild depression. She did not meet the DSM-5 criteria for major depressive disorder. So, in regard to her diagnosis, Axis 1 is generalized anxiety disorder, Axis 2 is deferred, Axis 3 is anticholinergic toxicity, and Axis 4 is emotional abuse from her father, social stressors in school, as well as the COVID pandemic, and Axis 5 is 70. I found a research article that talks about the effect of suicide, on the effects that the COVID pandemic has had on suicidal rates, and it says that since 2019, the pandemic has profoundly impacted the psychological status of many people, and the psychological sequelae of the pandemic was will probably persist for months and years to come. And studies indicate that the COVID-19 pandemic is associated with the stress, anxiety, fear, and of contagion, depression, and insomnia in the general population and among healthcare professionals. So please let me know if you have any questions. Thank you.